Welcome to Balls Deep, a humorous yet informative medical show with a mission of optimizing your performance in the bedroom, the bathroom, and the boardroom. I'm your host, Dr. Joe Pazona, a board-certified urologist and CEO of Pazona MD. We hope you enjoy. Now, let's jump right in. Hi, this is Dr. Joe Pazona again. Welcome to another episode of Balls Deep. And as usual, I am joined by my lovely co-host, Miss Kat Williams. How you doing today, Kat?
I have not been fired from this job yet.
No, I don't see that happening anytime soon.
Oh, let's not speak too soon.
What's new with you?
Oh, I have been to a new dentist this week.
Oh, how was that experience?
Well, it was really good. Apparently, I have excellent home care.
I would agree based on the 10 to 20 minute toothbrushing I've witnessed.
Well, apparently it is working for me. So,
well,
there you go.
Keep it up.
All right.
Keep it up. Well,
what are we going to be talking about today in the world of urology?
So this is a personal favorite, vasectomies.
Oh, fantastic. I think this is a personal favorite of a lot of women, too.
Well, the goal would be to get more men involved with this, and certainly guys are coming out more, and I got to say, are really taking ownership of this. And I'm seeing vasectomies happen more often, but we want to certainly increase the awareness, as they say.
I like it.
So awesome. Well, for those of you who are short on time, we have a Cliff Notes version in a segment that we like to call
Just the Tip. Number 1, there is no minimum age or number of children that you have to have in order to have a vasectomy. Number 2, a vasectomy is a lot less painful than you might think it is. And number 3, a vasectomy can actually improve your performance in the bedroom.
A lot of good things here to dive into.
Lot to unpack in there.
Yes. How about we go
Balls Deep.
Why don't we do this? Let's start with what is a vasectomy, because I certainly...
Excellent idea.
I certainly realize that in healthcare, we often make assumptions about people's knowledge. And I think a lot of these myths and concerns about a vasectomy will disappear once you really understand what we're doing.
So Dr. Pazona, tell us exactly what is a vasectomy?
So let's start with the anatomy. Okay. So first we've got the balls.
And that's the medical term.
That's absolutely. We use it in urology all the time.
Is it?
It's in the textbooks,
Okay.
trust me. So they sit in the sac and they make the sperm. And the sperm is what I'll refer to as the swimmers. And so in order for a pregnancy to occur, the sperm or the swimmers got to fertilize an egg. Okay. So how does it get there?
I don't know.
So after being produced in the testicle, the swimmer or sperm leaves, goes through something called the epididymis, which then turns into the vas deferens. Now, this is the tube that we're going to snip or clip or cut, whatever term you want to use, during a vasectomy. And so what I tell guys is we're putting up a roadblock such that the swimmer can't get to the swimming pool. What's a swimming pool? Well, that's where the semen is made back near a man's prostate, a couple organs called the seminal vesicles. So all we're doing is stopping the swimmers from jumping in the pool, which then leads to an inability to lead to a pregnancy. But the good news is orgasms, erections, ejaculation, the fluid even coming out, there's no change whatsoever.
Okay, that was a lot of information. I kind of feel like I'm back in gym class in the 6th grade when they were going over all of this, and I think I zoned out. So a vasectomy, just to back up, is a form of birth control.
Yes.
Right?
Mm-hmm.
But it is a permanent form of birth control.
Correct.
Right?
Yep.
It's not like when women take the pill, we can stop taking the pill and then things go back to normal. A vasectomy is meant to be a permanent solution.
100%. Now we know that life throws us curveballs, and there can be moments that happen in our life that might change a man's mind. But for the most part, a man should go into a vasectomy saying, all right, best of my knowledge, I'm done with kids.
Okay. So. Good to know. And you can reverse. This is not a procedure you personally do, but there is the possibility a vasectomy is reversible.
100%. 100%.
Okay.
You should never go into the
Never
vasectomy
go into it like
planning like, oh, I'm just going to get it reversed in a couple of years, but certainly be as certain as you can be at the time you make that decision.
Okay.
Yeah.
So moving on to the three things we were just talking about. So there's no minimum age, and you don't have to have had a certain number of children to be eligible or ready to have a vasectomy, correct?
Correct. This is one of those things that I really get fired up about. So allow me to
fired up.
Allow me
Okay.
to go in a little bit of a rant here
Fired.
with our current healthcare system. So I still think we're stuck in this, patriarchal, I'm the doctor, I'm going to tell you what to do, young man. And I think that's complete BS. Now, as a caveat, of course, we're talking about consenting adults, people who are capable of making medical decisions. Please look into your state definitions as to when, as you are considered an adult and can make this decision. By no means am I advocating doing a vasectomy on a 16-year-old or someone who's got mental impairment. But I think it is very disrespectful to tell someone, well, you're only 24. Why would you want a vasectomy? I've met 22-year-olds who already have 3 kids and they're like, dude, I can't afford any more kids. Like, I'm done. Or 23-year-olds who go, you know what? I've never wanted kids. And so that's the second point here, is that not only the age, but this concept of you have to have kids. Who am I to tell some adult that you should have a kid? Whether you have 0 kids or 10 kids, it's none of my business. And it just drives me insane when people end up in front of me going, well, you're the only guy who I found out would do my vasectomy because everyone else said they wouldn't do it.
So doctors are actually telling their patients, and there are no medical limitations, but they're making the decision for you.
Yeah. And I just find that, again, I think it's disrespectful. I think it's condescending, and it's just not necessary. And again, as a caveat, because I know someone's going to see this out of context, we're not talking about doing this on minors or someone who's not capable of making medical decisions.
The vasectomy is a very personal decision by a consenting male adult.
100%. And what works for you and your partner and your family is great. Whether you've got 0 kids or 10, not my choice. I'm ready as a resource when the time is right for you.
Got it. So then the next thing I want to talk about, you say that this procedure is actually a lot less painful than you may think. Because I think there are guys out there cringing, thinking of you, Dr. Pazona, getting a hold of their family jewels down there. And they're not excited about that because of a pain factor.
100%. Listen, guys are wusses.
You guys are. It's pitiful.
And
pitiful.
I'm one myself. So I don't say that at all trying to insult anyone else. I'm sure there's some stoic guys out there. In fact, there was a guy in residency training I heard who did a vasectomy on a Navy SEAL, and he requested 0 anesthesia, like not even local.
That's bold.
And the guy didn't even move. So there's some tough dudes out there, but as a whole, yes, we don't do pain quite as well as ladies. So what do we do to lessen that pain? And why do our patients leave almost every vasectomy going, that wasn't as bad as I thought it was going to be? So the first thing we do is we offer laughing gas. So this is not your dentist laughing gas in that it's a choose your own adventure. Guys get to breathe in the gas at their own rate, so they get as high as they want. And I have some guys who are asleep and snoring the entire vasectomy, and I have to wake them up. I have guys who treat it like they're at Zanies on open mic night and are doing their stand-up routine.
Yikes.
Probably the best story was I had this guy, I could only hear half the conversation because he had in his AirPods, and he called up a good buddy of his.
While the procedure is going on, while you are manhandling his business.
Manhandling's a little crass.
That was aggressive, sorry.
Gentle precision.
Surgical precision.
Absolutely. But yes, I'm down there doing my thing, and he's talking to his buddy, and he's like, hey man, you know what I'm going to do to your wife later?
Whoa, that went a different direction. Wow.
And, he just, you can tell these are like college buddies having that stupid conversation all of us guys have had before in private. And he's like, hey, yeah, this guy's grabbing my balls right now. Hey, man, how many balls have you grabbed? And he's like, he said he's grabbed thousands of balls. Isn't that crazy?
Are we safe to say he's not feeling a thing with this?
Clearly not, if he's
Okay.
able to simultaneously insult me as well as his buddy, but all in good humor.
Not to mention the buddy's wife.
Yes. So, but needless to say, guys do really well with it. So the gas helps.
Okay.
Second, we do a no needle, no scalpel technique. So for those of you listening and watching, maybe like, how do you do it if you don't have a needle or a scalpel?
Yeah.
So,
How does this work?
so we've got this little device that injects local anesthesia. That is a needleless injector. So think of it like it's like a spring-loaded, like a power injector. And so guys just hear a loud click. They feel like a kind of a flick. Again, back to the college days where us guys would walk around and kind of patsy a guy in the groin.
What are you guys doing in college? Wow.
Clearly nothing intelligent.
No.
They say the male brain takes till 25
Or
to-
45. So you have something that flicks
Yes,
some lidocaine.
correct. So it's a
Okay.
numbing agent.
It's a numbing agent.
But it's without a needle. And then, although it's a little gimmicky, we have it's called a hemostat, a little instrument that makes a little skin poke down there. So we do make an incision, but there's something to be said for the less trauma you cause an area, the quicker the recovery. And we can also do all this in most guys in under 10 minutes. So when you cause less trauma, when you do something fast but yet precise and efficient, it tends to lead to less pain. And I've had this done on a number of good friends and colleagues who have entrusted me to do their vasectomy. And they're often texting me within a day or two going, dude, do you even do anything? I barely feel it. And really was pretty darn easy. So we certainly have our guys who maybe are a little bit more dramatic and don't have that experience. I think you witnessed that one, Kat.
I did witness one gentleman who was clearly gunning for his Academy Award in his portrayal of pain, horrible pain. Of course, his wife was behind him rolling her eyes.
Yes.
But I think that was the only gentleman I've ever seen come through the office looking as though they really had anything done. And I think you still have a YouTube video up of you performing the procedure, the actual procedure.
Yeah, and it was actually filmed by a guy not on nitrous oxide. So it was the patient who was filming his own vasectomy.
Wait. The patient whom you are working on is filming his own procedure.
Yes. So great cinematography work.
Well, he deserves the Oscar. Wow.
Yes,
Okay.
absolutely. So clearly it's not that bad. And then that extends into the recovery. So other guys are like, well, I can get through a 10-minute procedure, but I don't want to be down for a while. And within 1 week, guys are back to any physical activity, whether it be in the bedroom or the gym. And guys could probably go back sooner, but I say, you know what, just take your time.
Take a break.
Give yourself the week off. And usually by then, they're doing great.
Okay. So truly, with this particular procedure that you do, it really mitigates a lot of the pain.
It certainly does. And listen, there are plenty of other ways to do a vasectomy. So I don't want to come across as, oh, this is the only way to do it. There are a lot of doctors doing no needle, no scalpel vasectomies or variants thereof in the country. I think the key is just go to someone who does a lot of them. And a lot of what we do is the bedside manner side of things. There's something to be said for walking a guy through a procedure. And that's often been the feedback I've received is, you just made this easy. So there are a lot of great vasectomists out there who also do this. If anyone needs any recommendations, happy to give them. But, it's a total experience. And so guys in our hands tend to do pretty well.
Okay. And remembering again, you guys are not that tough.
We're not.
Not so tough in the end. The last thing I wanted us to touch on, because you've mentioned this before, and I think everybody would be interested in this, a vasectomy can actually help better your performance in the bedroom. How is this possible? Is this true?
What a bold statement.
Bold. So bold.
So there actually was a study, and it showed
A legitimate medical study.
A legitimate medical
Okay,
study
it's out there.
showing that a certain percentage of couples reported improved satisfaction in the bedroom. And why is this? What's sexier than a guy who takes control of contraception? Women for decades are on the pill, worrying about the condoms, the ring, all of this. And us guys are like, oh, whatever.
And we're tired.
And
honestly, we're tired.
And so when a guy takes control, that's sexy. I think a secondary thing is I think people underestimate the unstated stress of an oops. Now, listen, every child is a gift, and whether, again, you've got 0 kids or 10 kids, almost every parent I've run into is like, they weren't planned, but we're so glad we had them. All that aside, imagine you're in your 50s and you're a couple ways away from being an empty nester, finally retirement, and get to travel with your wife, and then that pregnancy scare. Or
that's stressful.
It's
absolutely really stressful.
And so when you look at it, a vasectomy is the most reliable long-term form of contraception. In fact, our fact of the week is that the true failure rate of a vasectomy is 1 out of 2,500 vasectomies. Now, the actual failure rate is lower than that because guys don't follow the instructions. So guys, you have to do a sperm check. I like doing it at least 2 months or 20 ejaculations, hitting both of those numbers after the vasectomy, to then do a testing kit, because again, nothing changes. And so unless you test under a microscope and go looking for the swimmers, you won't know when and if it works.
You got to do your homework,
You've got to do your homework.
If you don't do the homework, forget it.
Yep.
You got to do the homework. But that is an incredible stress that is alleviated. And speaking from the women's point of view, we have had all of this in our court for decades, centuries. And now to have men stepping up to the plate and taking care of the birth control on their side with a vasectomy is, I think, pretty incredible. And pretty great, because the surgical techniques open to women on the level of birth control aren't great.
Yeah, I mean,
and are a lot more challenging and pose a lot more potential risk. Am I wrong on that?
No, not at all. I mean, listen, a tubal ligation is a pretty routine surgery, so I don't want to make it seem as if it's some deadly procedure. I don't believe in, conspiracy theories and putting things out of proportion. But it's still a major procedure done
surgery.
It's done under anesthesia. You're operating around intestines and other organs. And listen, if you're a woman not in a relationship and that's your only means to make sure you don't have more children, by all means. But if you're in a committed relationship, there's no reason a man shouldn't have the vasectomy and really step up. And I will say, I'm really proud here in the Nashville region and elsewhere for guys who travel to us that I'm seeing more and more guys step up and really own this. And I think it's really endearing when I have a guy go, I'm doing this for my wife. I'm doing this for my partner. She's struggling with birth control or hormones, or she was a really high risk pregnancy and I don't want to put her at risk. And so kudos to all those guys out there who've been snipped but are still equipped. I think this is fantastic. And we absolutely have to build awareness.
Snipped, but still equipped.
Absolutely.
So that's a big part of this. Nothing changes.
Nothing changes.
You have the vasectomy, great form of birth control, permanent.
Yeah.
But everything else still functions as normal and maybe even a little better.
That it does.
Wow.
Well, Kat, I can talk about vasectomies for several more hours, but our goal is for this show to be something you enjoy on your commute into work, or in those few moments you have peace and quiet in your house. So any final thoughts, Kat, on vasectomies?
I don't know. I learned a lot today. It kind of feels like a vasectomy is way better than the old thing of backdoor no baby.
Really?
Don't you remember that? People used to say that. I don't know if it was actually a thing, but it was a as a statement.
Well, I think you'd get some arguments from some people as to which is better, at least from the
It's
guy.
not better.
From the guy perspective, I think.
I think vasectomy, people. I think vasectomy. I also think I'm going to be out of a job pretty soon, but it was fun. It was fun being here.
No, we love having you. So thanks everyone who listened this week on Balls Deep. And remember to just show yourself a little more love and grace. Setbacks are opportunities to grow stronger. Thanks and have a great day.
Thank you for listening to this week's episode of Balls Deep. If you'd like to join our stream team of listeners, please click the subscribe button on your favorite podcast platform. For more information about our practice, Pazona MD, please visit PazonaMD.com. This podcast is for informational purposes only, and the content is not intended to be a substitute for professional medical advice. The show does not constitute the practice of medicine. No doctor-patient relationship is formed through this podcast or any of the social media channels related to this show. The use of this information is at the user's own risk. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.